Decisions, decisions, decisions. There are so many decisions to make when you're reviewing your medical plan options. Your needs are specific to you and your family, and there is no one-size-fits-all medical plan. We offer you 4 medical plan options, all with Blue Cross Blue Shield of Kansas City, to allow flexibility based on your needs. Have no fear. Business Services is here to help you make the most of your medical plan. To start, let's touch on some of the medical terminology you will hear. A copay is a set price you pay for a service. The HMO and EPO plans have copays. A deductible is the amount you pay out of pocket before Blue Cross begins to pay a share of your healthcare expenses. Both high deductible health plans have medical deductibles. The HMO and EPO plans have prescription drug deductibles. Coinsurance is also known as cost sharing after you satisfy your deductible. Blue Cross will pay a percentage of the costs, and so will you. Picture your out-of-pocket maximum as a bucket that all your covered expenses help fill throughout the year. Those expenses include all medical and prescription deductibles, copays, and coinsurance you pay. What do you need to consider when looking at your medical plan options? Ask yourself, what is my cost comfort level? Do I need to cover family members or just myself? How often do I or my family see a doctor? Do I or my family need ongoing medical care, have a chronic condition, or take maintenance medications? Do I or my family have a specific doctor or hospital we would like to or need to use? For most of us, the dollars deducted out of our paychecks are also an important consideration when selecting a medical plan. Let's call these payroll deductions upfront costs. But what about the costs you pay when you receive care, such as copays and deductibles? We'll call those pay-as-you-go costs. Generally speaking, when your upfront costs are higher, your pay-as-you-go costs will be lower. And on the flip side, when your pay-as-you-go costs are higher, your upfront costs are lower. Now keep in mind, there are some services on the district plans that have no pay-as-you-go costs. You don't just see the doctor when you're sick, right? Routine preventive care is a vital part of maintaining your health. All of the district plans allow you to receive routine preventive care services at no cost to you when you use the Complete Health and Wellness Center or an in-network provider. These services include routine physicals, recommended immunizations, mammograms, colonoscopies, and more. You may also enroll your legal spouse and dependent children. Children are eligible until the end of the calendar year in which they turn 26. They don't need to live at home or be a student. They can even be married or eligible for coverage through their own employer. Dependent children over age 26 who are incapable of self-care are also eligible for coverage. Reach out to Business Services for more information. If you need to cover your family, be sure to consider your spouse and children's healthcare needs when selecting a plan. Another thing to consider is how often you and your family visit the doctor. This can make a big difference in your healthcare costs. If you or your dependents have an ongoing chronic condition, you may visit the doctor more frequently, and you may take maintenance medications to help manage your symptoms. Now that we've covered the costs associated with the plans, let's discuss the network options. The HMO plan requires you to use providers in the Blue Care Network. The Blue Care Network is a smaller local network. Remember, there is no coverage if you see an out-of-network doctor or go to an out-of-network hospital on the HMO plan, except in a life or limb-threatening emergency. The EPO and Preferred Care Blue high-deductible health plans allow you to use providers in the Preferred Care Blue network. The Preferred Care Blue network is a large national and international network. The Preferred Care Blue high-deductible health plan allows you to use the out-of-network providers. However, your costs increase and the providers can bill you beyond the Blue Cross Blue Shield contracted amounts. There is no coverage if you see an out-of-network doctor or go to an out-of-network hospital on the EPO plan, except in a life or limb-threatening emergency. The Blue Select Plus High Deductible Health Plan allows you to use providers in the Blue Select Plus network. When you are in the greater KC area, you should access providers in this network. You have the freedom to use out-of-network providers. However, your costs increase dramatically, and the providers can bill you beyond the Blue Cross contracted amounts. If you live or are traveling outside of the greater Kansas City area or have kids away at college, the National Blue Card Network can be utilized to receive in-network care and coverage. When in-network providers are used, your pay-as-you-go costs will be lower than when out-of-network providers are used. Check to see what network your doctors and preferred hospitals participate in by calling Blue Cross at the number on your screen or visit bluekc.com. You can also find Blue Cross provider directories on the LSR7 benefits website. You might want to consider sharing this video with your co-decision makers. For more plan details, please visit LSR7's benefits website. We are here to help you make educated choices about your benefit coverage. If you have questions, please contact Business Services. We know your time is valuable, and we thank you for taking time to fit some benefit education into your busy day.